The gentleman will now recognize Mr. Dodaro for 5 minutes.
Thank you very much, Mr. Chairman. Good afternoon to you, Ranking Member Congressman Cummings, members of the committee. I'm very pleased to be here today to discuss GAO's 2015 report. We identified 24 new areas with 66 recommendations. These include a recommendation to the Congress to create a formal coordinating group to focus on the oversight of consumer protection issues. There are 20 different agencies involved in this effort at least. There's fragmentation, overlap in responsibilities, and greater efficiencies that can be achieved, as well as better protection to the public. We also have recommendations for greater coordination among the 42 programs and 6 agencies that provide non-emergency medical transportation. Here, we're concerned that not enough cooperation has been gained yet from the Medicaid and VA programs, which are big players, and there's not a cost-sharing agreement in place. The Council coordinating this activity hasn't met since 2008. This is a big issue, particularly with the aging of our population and the need for these non-emergency medical services among the aged, the disabled, and those without the means to provide their own transportation for needed health care. We also identified a component of a provider within the DoD healthcare system that was set up originally in 1982. It's now being duplicated by the TRICARE program, which was established in the 1990s, and we recommend that that component can be eliminated, thus saving millions of dollars with a careful transition to ensure that nobody has interruption in services that are provided. We also recommend reexamination of the Strategic Petroleum Reserve. With U.S. production now at record levels and reserves growing, both in the Strategic Petroleum Reserve and the in private sector reserves, we now hold much more than we have to meet international requirements in the reserve. This could free up potentially, based on the reexamination, oil that can be sold to reap billions of dollars that could be used for other government priorities, and also reduce the operating costs of the Strategic Petroleum Reserve, which is aging and in need of further repair. We also identified areas that were established of 11 hospitals that provided cancer treatment in the 1980s, when most of cancer treatment was inpatient concern. Now, more hospitals can provide it. It's outpatient concerns. And if those hospitals were treated the same way other hospitals that are treating cancer payments now, and they had a level playing field, the federal government could save $500 million a year in Medicare spending, health care spending. So these are a few of the examples. As has been mentioned, in the past 4 years, we've had over 440 recommendations. 37% have been fully implemented, 39% partially, 20% not at all. The amount of money that's been saved so far has been $20 billion in implementing our recommendations, with another $80 billion in the works that should be achieved in the coming years. But there's plenty of money left on the table here in areas that can produce additional $1 billion in savings and efficiencies. We've grouped them into a number of categories. It could be more aggressive on strategic sourcing to leverage the government's buying power. Right now, OMB is moving on this, as Beth will talk about, but we need to be more aggressive in setting targets and to achieve the savings that are necessary. In February, I was before this committee talking about IT operations and acquisitions. We put it on our high-risk list across government. Their concerted efforts could save millions of dollars, if not billions of dollars, in waste and inefficiencies in IT operations. We've got many recommendations to streamline activities at the Defense Department to reduce overhead, help control their health care costs, reduce the cost of weapon systems. We have recommendations to reform Medicare and Medicaid payment processes and oversight processes to reduce health care spending, which is much needed at this point in time. We've got recommendations to also increase tax revenues and to rationalize some benefit programs where there's some overlapping and duplication and benefit programs. So I appreciate the opportunity to be here today and discuss these areas in further detail during the questions and answer period when it's appropriate. Mr. Chairman, thank you very much.